The accuracy of these rapid antigen tests, there's been a lot of confusion in the public about how accurate these are. And I have to start by saying accuracy depends on what the target goal is. So if your goal is to be able to have a test that can detect people when they are potentially able to transmit the virus to other individuals, these tests can be very accurate. The recent one that just came out by Abbott shows that they have around a 97% sensitivity to detect people in the first week of infection of symptoms. And that we know is when people are most likely to transmit to other people. So they can be very, very accurate.
The rapid antigen test looks to see if somebody is currently infected. So it detects actual virus that you have in your nose. And so the test is a yes/no whether or not it detects the virus. It's the rapid test that Abbott Labs put forward that just got an EUA for. You can get your answer in 15 minutes, which is a lot better than some of the other tests that we have been having massive delays. The best thing about this new Abbott test is that it doesn't require a machine, and that has been a real plus. So you could have a school nurse, for example, administer this test versus having to get all the equipment that will allow you to read it, which is found more in like laboratory settings. PCR tests look for the genetic material of the virus, and it amplifies the signal it gets so that it can detect very small amounts of that genetic material. And that's why it is able to detect people who are sick before they may know it. The PCR test is definitely more accurate than the rapid antigen tests. People are trying to talk about the rapid antigen test as more of like a contagion test, because it will do better if you have high amounts of virus in your nose versus PCR, which can detect, give you a day's advantage before you reach that level of viral load.
This massive number of tests are going to be deployed in a variety of ways. We're going to be sending a lot of these to visiting nurse practitioners and other environments in home care, basically. We're also sending millions of tests that are going to be targeted towards senior centers. We're going to send a lot to the states because the governors are in charge of their states, and we're there to support them, and however they decide to use them and allocate them in their states, they will have the flexibility, of course, to do that. This is a federalist system. We don't dictate to every state what they're going to do.
I think that it could be a very useful tool for the administration to actually start creating cohesive policy around and actually be able to distribute them maybe on a day-by-day basis to where they really need to go. The only way to really stay ahead of the curve is to test frequently so that you're very likely to get somebody's test performed on them during their first or second day of real infection. Our mathematical models suggest that we could probably have around half of the people choosing just not to use the tests at all, another 10% of people incorrectly using the tests, and we'd still be able to really drive down the prevalence of this virus. So they don't need to be perfect. They don't need to be distributed perfectly. They just need to be distributed to a lot of the people where cases are happening most frequently today.
There is no drawback in testing being done here. We are going to increase testing. We're going to do it even smarter than what was done in the past with leveraging this incredible capacity to do tests, and we're going to result in saving more lives.
You need to have consistent messaging about what the tests do say and what they don't say. It's not a get out of jail free card. It is telling you at that moment, that test is saying that you're negative for COVID. And there are limitations on all diagnostic tests, that there are false positives and false negatives. For this kind of test, it's more likely to be a false negative. I don't think we're going to go back to any sort of normal, the way normal was before. even with a vaccine. But we will have a much better situation that's more normal-like than before if we have better testing.
I think we will definitely get back to normalcy eventually. This virus probably will stick around with us, but the important thing is once vaccines are around and sort of this whole idea of flattening the curve, we will continue to see some cases here and there, which means that over time, people will start to gain immunological memory to it, either through vaccines or unfortunately through infections. And so that alone will get us to a state where the virus is no longer a major threat in terms of massive outbreaks.